Hello. In my previous video, I spoke to you about diseases affecting the nerves or neuropathy and what are the common reasons behind that. Namely, diabetes, B12 and other vitamin deficiencies, autoimmune diseases or cell against cell disease, and blood malignancies which may affect the nerves. Today I'm going to talk to you more in detail about diabetes and your nerves. Now, diabetes is the most common reason that one gets neuropathy. It has been estimated that up to 30% of all cases of neuropathy are due to diabetes. Now, how does diabetes affect your nerves? Diabetes can affect the large nerves of your hands and legs, and when this happens, you get tingling and numbness of your feet and then your hands. Diabetes can also affect the large nerves of your thigh and lower trunk. When this happens, you don't tend to get tingling and numbness so much, you tend to get more weakness. And this weakness can manifest as difficulty in standing up from a chair and difficulty in walking due to weakness of the thigh and lower trunk muscles. In addition, diabetes can also affect the small nerves. Now, the difference between the small nerves and the large nerves are, the large nerves have a covering around it called myelin. To a certain extent, this myelin protects the nerve from getting damaged. The small nerves do not have any covering around it, so they are much more likely to get damaged for whatever reason, whether it's due to an injury, whether it's due to diabetes or due to vitamin deficiencies or any disease process affecting the body. When the small nerves are affected, they present as burning pain or lightning like sharp pain. So you may get burning pain in your hands and in your feet due to involvement of the small nerves. When selected small nerves that supply the blood vessel, these are called autonomic nerves, when they are affected, then you may get lightheadedness from lying to sitting or from sitting to standing. Now, this occurs because there is a drop in blood pressure from lying to sitting or from sitting to standing when the autonomic nerves to these blood vessels are affected. Hence, these blood vessels lose the ability to regulate the tone, and when they lose the ability to regulate the tone, your blood pressure may drop from lying to sitting and from sitting to standing. So this is an entity called postural hypotension. It can be caused by involvement of the autonomic nerves by diabetes. Diabetes may also affect the small nerves in your eye. In the eye, each eye has 3 nerves which control the muscles. Diabetes may selectively affect only one nerve, causing blurring of vision or causing double vision. Diabetes may also affect selected nerves in the hand or leg. If it affects the hand, you may get numbness in selected areas of the hand. If it affects the leg, you may get a foot drop. Now, when does diabetes start affecting your nerves? So your nerves are very sensitive to changes in blood sugar. Even if you're in the pre-diabetes stage, your nerves in your head and feet may start getting involved and you may start getting tingling and numbness. So nerve involvement by diabetes occurs pretty early. The worse your control of diabetes, the more neuropathy or nerve pain that you will get. So the worse the control, the more tingling and numbness and the more burning pain that you may get. However, it is important to remember that when you're on treatment for diabetes, it is important not to drop the blood sugar too drastically. Now, what do I mean by that? Now the blood sugar control is measured by hemoglobin A1C, which is a measure of the average sugar in your bloodstream for the last 3 months. So a hemoglobin A1C of 5 to 6 indicates good control. If your hemoglobin A1C is 10 to 12, it indicates your control is pretty poor, and do not drop this by more than 2 percentage points over a span of 8 to 12 weeks. So for example, if your hemoglobin A1C is 12 and it drops to 4, this is too drastic a drop in your hemoglobin A1C, and this can cause an entity called treatment-induced neuropathy of diabetes. And in this condition, you may get burning pain in your hands and your feet and in your trunk as well, because the blood sugar has dropped too drastically, and this metabolic change in the body can affect your nerves. So the blood sugar must drop by 2 percentage points every 8 to 12 weeks. So it is important when you're on treatment to follow a good diet, to take a medication, and it is important to remember not to be too enthusiastic and too drastic in a drop in blood sugar, because the bigger the drop in blood sugar, the higher the chances of you developing treatment-induced neuropathy of diabetes, and this is a very painful condition, and there is no specific treatment for it. The treatment is to stabilize the blood sugar control, and the neuropathy will heal by itself. I hope you've enjoyed this video. Thanks for watching, and I'll see you next time.